Good evening, I'm Geraldine Sen.
And I'm Ziad Parvez.
Fiji's annual mortality rate for diabetes stands at almost 1,700 according to the latest World Health Rankings. 1 out of every 5 Fijians is at risk of contracting this deadly NCD, and more needs to be done to address this serious health issue. Tonight, we have guests from Diabetes Fiji joining us to discuss this in detail. Good evening and welcome to the show. Good evening. Getting straight to it, looking at the numbers, what are your thoughts on that? 1,700.
Yes, sadly, that report came out and we got the gold medal. And we were top of 180 other countries. Yes, it's a concern. Yes, there's been people who have questioned the statistics that went into that. And I think we should just move away from the fact, yes, we are very high on the list. It is one of the major causes of disease. But this you can group into the NCDs. Mm-hmm. So diabetes is a problem in this country.
Looking at the numbers, though, you'd think that people would be more aware of changing their lifestyles. What are the contributing factors to getting this? Most people usually just narrow it down and say it's genetics, but there's more to it than that.
Diabetes is a complex disease, and I, as a clinician, would say that yes, what we're dealing with and what we're talking about is those with complications of the disease. And yes, the complications including eye problems, kidney problems, feet problems, generally infections, and we see this in huge numbers. Okay, 60% of our admissions to hospitals have a diabetes-related disease. 40% of our operations are because of diabetes. What we're saying is that I think we're doing a great job in dealing with the complications. We just have to stop them from coming into the hospital. Mm-hmm. And being aware of diabetes and its complications.
Well, looking at, of course, the number of amputations that are taking place, the numbers so far stand at almost 1 at every 8 hours. That is huge. That's monumental. Mm.
Sadly, I'm an amputator, and I teach and cut limbs off. Again, I tell people we don't do this because we enjoy it. Mm. We do this because people come in as very sick. Mm-hmm. Very sick with diabetes, sepsis, and infections of their feet. Why do they come in late? For a very complex situation. I mean, sometimes it's just rapid progression of disease, mm-hmm. and we cut limbs off to save the life of the person. Mm-hmm. Okay, and yes, our figures are alarming. Yes, you read about it, 1 in 8 hours, 1 in 12 hours, depends on what you want to read. And yes, we do an average of, just say, 200 amputations, major amputations a year in this country. That's not the toe, that's or part of a toe or part of a foot. That's an amputation below the knee or above the knee. Mm-hmm.
Before we move on further into amputation itself, let's talk about some trends. The top 20 countries, 7 of those are from the Pacific, and the World Health Organization cites changes in diet as one of the reasons why the Pacific is so high. Could you explain more on that?
Yeah. Apart from the gold medal in diabetes, you know, you read the diabetics books, and in the past, you've always said a group of Pima Indians in America were in the top, and Nauru was progressing. But now, Pacific. We also have the gold medal for obesity and in the Pacific, and it is a problem. Yes, we have increasing numbers of diabetics, and right now that sits at about 16% of our adult population have diabetes. And yes, we have a problem with our lifestyle and eating habits.
People usually think that you don't have to go to the doctor unless and until there's something very wrong. But you yourself, Mr. Giu, you're pre-diabetic, and you found out about that some time ago. Tell us about your experience with that.
It's something that you are unaware of, something that you get to know when you get tested. So it's very important that you get yourself tested for your blood glucose, because you might be just walking down the street, not aware that you have diabetes. And as Professor has mentioned, these are some of the factors that we end up in complications because we are not aware of our health status. And then we usually are not following our diet, or not living a healthy lifestyle, which is very common. We have very stressful work, and then sometimes we do not do a physical activity, and then we always indulge ourselves in the diet that is very high in fat or probably high in carbs, and then we lack to have a regular yearly check and that's one of the important things. So I was tested myself once, and then I saw that my blood glucose level was really high. And then after that, I started changing my lifestyle, trying to control my diet and incorporating physical activity. At times, you happens to miss out some few things, but you have to monitor your diet on a regularly. That's other important things. And because I have high risk because of my parents with diabetes.
So that's a prime example of being predisposed because of your genetics, and also you're pre-diabetic, yet you managed to control it without actually getting into becoming a diabetic patient. But most people don't realize that once you're a diabetic patient, it's a lifelong thing. And I happen to have family members who have diabetes. Many people think, I've had diabetes, I've got medication, I can eat and do whatever it is I want as long as I have the medication to do that. But that's not the right way to go about it, right?
Again, we keep going back to the extremes of the disease and the complications. People do die with diabetes. We amputate, as I was saying, hundreds of limbs. We amputate. We have maybe 50 a year who go into renal failure and need dialysis. A whole host of people get blind. A whole lot of people, 60% of our hospital admissions have a diabetes-related condition. Okay? So how does one prevent that? Prevent early detection and good management of your condition. So, example, how do you prevent a foot, having a foot problem? Just watch your foot, review your foot, keep your feet clean, wear shoes. So those things. How do you prevent a kidney problem? Control your diabetes, control your blood pressure, etc., and good diet. How do you prevent an eye problem? Early detection, regular checks up with your eyes, and what we need to do is bring it up now, but there was a stakeholder meeting we had about 2 months ago, and the stakeholders meeting is everyone involved in diabetes: surgeons, physicians, ophthalmologists, renal physicians, foot. So it was decided at the time something needs to be done. We have to stop this, and the words being used, bantered around, things like it's a tsunami, okay? It's like a burning oil platform. It's out of control. We need to do something, and we need to do it by getting a team together, okay, to be diabetic focused.
On that note, I know that Diabetes Fiji's has made some recommendations on what needs to be done, but we'll be back with more after this break. Welcome back. Now, Professor McCaig, you mentioned earlier on about the need to have a particular department, and of course Diabetes Fiji has also made recommendations for Fiji to have a particular department set aside with endocrinologists specifically to deal with diabetics. What is the need for that, though?
We had this stakeholder meeting where everyone involved in diabetes management was asked to. We had this meeting where we discussed things, and at the end of the day, it was established that whatever we're doing, we're not doing a very good job. So we're having the 16% of people with diabetes, but mind-boggling amount of complications we were having. It was out of control. So it was decided, where can we go from here? So we needed a specific group to look after diabetes and its management. We also needed this to come from the top. It was even suggested that it should be at the prime ministerial level, cabinet level, that we must get the Ministry of Education, the Ministry of Health, Ministry of Agriculture, Ministry of Labour to get involved in the management of diabetes, detection, management, etc. Why the Ministry of Education? The education must start with kids. We must have in our curriculum a health perspective on how to be healthy. Tell our kids how to eat, etc. Ministry of Labour, exactly.
While we're talking about curriculum, isn't there a lot of stuff already there in the current curriculum that teaches kids about healthy eating? Do you think that's not enough?
What we need to do is, again, what we're having, we've got all these groups working in isolation. What we need to do is have a group looking at diabetes and let them make the curriculum. Okay, we got too many pods.
Well, I'd like to touch on the complications of diabetes. We'll get to that in a bit, but very quickly, Mr. Ngio, looking at what Professor McCaig has said about the need for more education, Diabetes Fiji already has a lot of work going on where they are going out to create awareness on this, yes?
Yes, the project was focusing more on the secondary care, which is probably the training of the nurses, the training of the doctors, and we had trained about 210 nurses and 189 doctors. And now we're going to the patients themselves living with diabetes, and we have established 29 peer groups. And then we think, as Professor has mentioned, the training and the programs that have been done is done at that secondary care level, and there's a need for primary care level of prevention, and that's where we want to target the children. We wanted to get this NCD message very early, so children can know what's the things they have to take up in the healthy lifestyle.
When you say primary care, you're referring to pre-diabetes?
No, primary care means at the grassroots level, targeting the school children, targeting stakeholders.
Okay.
Well, we're talking about school children. Doctor, I'd like to pose this question to you. You're a medical professional. What if someone has done everything completely correct in their entire lives? They've eaten healthy, they've stayed away from sugar, but just because their parents had diabetes, it's in their genes. Does that affect the likelihood of a person like that contracting or developing diabetes?
Yes. I mean, what happens is, if your parents have diabetes and you follow the ways of your parents, whether it's be drinking alcohol, smoking, not eating right, the likelihood of you getting diabetes is going to happen.
And what if you stayed away from all of those things and you still got it?
You are less likely to present with diabetes and less likely to have the complications.
Well, looking at the stats of diabetes itself, you said 60,000 people in Fiji having diabetes, but of course that's a bit of a blurring number. That is for type 2 diabetes, correct?
Yeah.
And then you have type 1 diabetes. Type 2 diabetes, you've got the youngest patient who is 11 years old, and type 1 being 2 years old. That is quite alarming when you think about it. What do you think has caused that? What contributed to these children catching it on that young?
It's not something you catch, something you
So
get.
contract, I'm sorry.
Type 2, you're just not producing enough insulin. And call it bad luck. But most of this, at this age, they present with complications. As I said, I told you this morning we discussed a 24-year-old whose limb was amputated. 24-year-old, whose limbs are amputated. So it is a real problem, and certainly something. Again, we don't want to cut these limbs off, but we cut the limb off to save the life.
Was the patient aware that they had diabetes?
Yeah, inevitably, as I say, we've got 60,000 diabetics. We think 15.8% of our population have diabetes. 60,000, and we went out and tested those who have diabetes knowing and on medicines. Only 20% have controlled diabetes. So we don't even do that right. We don't even take our tablets on time. We don't exercise. So we know you got diabetes, or you know you got diabetes, and 80% are poorly controlled diabetes.
You do a lot of work at the CWM hospital.
Yep.
And I'm sure you're aware that there's a growing body of people who claim that doctors in Fiji just find it easy to amputate, cut off legs.
No, that's just a fact. I mean, people say you go to the hospital and we cut your leg off, but inevitably we are cutting limbs off, and we do a lot of leg cutting. Okay, about 1,000 limbs or part of limbs are amputated each year in Fiji, and 150 major amputations done. That's meaning below the knee amputations are done at the CWM hospital. But almost inevitably, these people, this is done to save their life.
Well, how do you determine that particular patient is in need of having an amputation?
Okay, that's complex. People get foot sepsis because their blood supply to the foot is sometimes compromised. They have no nerves to the foot, so they stand on things and can't feel. There's nerves that supply the moisture to the skin. They don't have that, so it cracks up. They are immunocompromised, meaning their white cells can't combat the disease, and they have diabetes. So their sugar is sweet, so it's a perfect medium. And people can have a scratch on their leg. I'm not talking about the person who comes in with an ulcer. I'm talking about a person who comes in near death, blood sugar extremely high, very sick. We recommend an amputation immediately to save their life. Inevitably, they say, no, think about it tomorrow. And tomorrow we're recommending a higher amputation. And a lot of people are dying, you know. And so, yes, we cut off a lot of limbs. We'd like not to cut off limbs, but CWM cuts off limbs because they're coming in too late.
Well, the only reason I suppose you'd be doing that is, of course, like you've mentioned, to prevent things from getting worse. I'd like to discuss the other complications apart from just having an amputation done, but we'll get into that after this break. Welcome back. Now, Ziad, I believe you were talking about amputations and the complications. You've got a question?
It was an interesting yet scary discussion. Are there any other alternative forms of treatment besides getting an amputation?
We tell people, I teach my students that indications for an amputation is the 3 Ds. Okay, one, if it's dead, and does the limb go black, and we have no alternative. They come in with a black limb, okay, and there's no blood supply, so we cut it off. And if it's dangerous, and dangerous limbs are those we do to save the life. They got an infection that's started locally and becomes systemic, and we cut that off. And if it's a dire nuisance, sometimes we cut limbs off because the limb is useless, it's got ulcers. Ulcers left long enough become cancerous, and so is there alternative to cutting limbs? Not really.
So the assertion or claim that doctors find it easy to cut off limbs is just a myth. It's not true at all.
No, it's not true at all. I mean, we don't enjoy cutting limbs off. We do it out of necessity.
Well, of course, diabetes doesn't only have amputations as an end result, as a bad complication. There are other complications to it. You have renal failure, you have retinal, cataracts and all that. Could you just tell us more about that, and what are the numbers like? What are the stats like on that?
We have, from an eye point of view, we have units, Pacific Eye Institute in Brown Street, and they have screening for diabetic retinopathy. That's done on a regular basis every day, and it's recommended that diabetics do get checked out. If you don't get it checked out, there's a high incidence of becoming blind. From a kidney point of view, the end point is renal failure and dialysis. And you see, it's concerning enough for the government to give another $2 million from the budget, and a recommendation they're going to try and bring the costing down. We have units in the country, Lambasa, Suva, and Lautoka and Nandi, and they're charging on average $250 a session for dialysis, and this is usually required 3 sessions a week, which is, I mean, who can afford that?
Right. So looking at the complications, though, if I were to be diagnosed with diabetes, and if I were not to be managing it pretty well, how early or how long does it take before any of these complications kick in?
The kidneys, they said if you have diabetes for about 15 years, you'll have it affecting the kidney. With the feet, all you need is an injury. And
while I'm diabetic?
While you're diabetic. All you need is an injury. You can be well one day, and you develop a itchy foot, and you scratch it, or you stand on a nail, and wow, the next day the foot's all swollen, red, and if you've had diabetes for a long time, it's affecting your nerves, you can't feel what you stand on, and then you get the ulcer. Okay, and we have foot clinics which helps manage the ulcer. We can design your shoes to offload the ulcer. We get your blood sugars under control. So,
looking at blood sugars, though, what is the normal range for a healthy person?
What we say, if you have a random blood sugar, so we take your blood after your meals, etc., and if it's above 11.1, and a fasting blood sugar of over 7.1 with symptoms, and recently it's HbA1c over 6.5, you're then a diabetic.
I see. So going back to it again, what would be a healthy number, though?
Healthy number is kind of between the 7 to 9-ish.
And if it goes lower than that, then there's complications there as well?
Hypoglycemia. You need sugar to kind of nutrition for your brain, keep your brain working. So if I became hypoglycemic now, I just fall to the ground, you know.
Besides getting a blood test, for the benefit of the public, what are some symptoms that are very obvious in a diabetic patient?
Sadly, the symptomatology includes polyuria, so you're wanting to pee all the time. Polydipsia, where you're always thirsty. Okay, and they've added that thing called polynesia, So islanders, bad news. Okay, and obviously infections. Infections, eye problems, and
When you've been going around doing work with Diabetes Fiji, liaising with the people, how prevalent is diabetes in, say, the urban centres and in the rural sectors?
Have you noticed a difference?
Yes, we've noticed that as it's more prevalent in the urban centers, especially the corridor of Novoa to Nosori. In the rural areas, we've seen not much, but then we've noticed a slight increase because of the change in lifestyle, probably change in their diet. Now they usually go fishing and then they bring their fish to the market and take back tin fish.
I see.
Yes, so they sell the root
Counterproductive
crops.
pretty much.
Yes, they get to sell the root crops and then they substitute it with noodles. So, but yes, it's more prevalent.
And that would obviously corroborate the claims by the World Health Organization. But what about other developing countries that don't seem to have this problem?
oh, rest assured, we represented Fiji Diabetes at the World Congress on Diabetes in Abu Dhabi in December of last year. 8,000 participants. The whole world's got the problem. Okay, the whole world's got a problem. We are no different. The incidence in Fiji we know is up to 16%, but United Arab Emirates are now 25%, and Asia is also very high. There's no boundaries, wealth, etc. Wealth and economy of the state usually is an indicator of the complications. So India is very bad, 20-25%.
I'm sorry to interrupt,
No.
but just quickly before we wrap up this segment though, looking at the numbers and looking at the money that's been allocated by government in the coming budget, when you compare it to, say, education, it's quite low. And with all of this happening, you know, with so many amputations taking place and you have so many diabetics and you have a need for all these new departments, what would you recommend be done? Do you think that the money that's been allocated so far for the health ministry is enough?
I mean, it's more than money. Certainly more money will help. More money. But I think going back to the one pod instead of numerous other pods, we need to go to education. We need to go to the Labour Department. Why did I bring about the Labour Department? We need to tell, the armed forces where we got control of, you're not allowed to get fat. We need to be strict enough to say, if you're a soldier, if you're a policeman, Navy officer, nurse, civil servant, if you, and I've mentioned this in the past, if you come in weighing 90 kilograms and you blink and you weigh 120 kilograms, we need to not employ you anymore. So we need to get the message across. It's a serious disease, it's killing people, and move on. So certainly more money will help. But as I was saying, 60% of our admissions to hospital have a diabetes or NCD-related disease, 40% of our operations.
So you'd recommend not only a little bit more money, but also different policy changes as well?
Yes. Whatever we're doing now is failing, or has failed.
So looking at education itself and what's being done in primary schools and high schools itself, I'd like to have a little bit of a discussion with you, Mr. Ngio, but we'll be back with more after the break. Welcome back. Now, Mr. Ngio, we were talking about the education sector and how much needs to be done or how much has already been done in educating the youth, especially in the primary level. You've been to schools. What's it been like?
Yes, so we've been to school. We've been doing education programs at school at very little, not much. But we've seen some of the curriculum or the education material that been used. Some was a source from very unreliable source, and you have this wellness unit. We know you can always liaise with to get reliable sources of information, especially at that primary school level, like grade level 5 or level 6 and level 7. Secondly, when they go up, they have this NCD component in their study, but it's not very in depth. It's just very short, and then it's off again. Yeah.
So although there is a curriculum, you recommend that it needs to be developed further if we're truly going to address diabetes.
Right, if it has to start from going down to the lower level, then it starts with a healthy eating, incorporating a healthy, even the life skills of people, For example, teaching them how to prepare healthy meals, at home. I know kids, they get used to the fast takeaway and they don't know even how to prepare a healthy sandwich. And then secondly, not only that, even making a home backyard garden.
So in the community work that you've done, have you seen a general trend in the attitudes of parents?
Yes, parents plays a very important role. What we've seen is that now that that the lifestyle parents are bringing, it increases the risk of children. It starts right from birth. A child needs to be breastfed. And then we have this situation where there is a working mother. Then probably you can still breastfeed, and then you can bottle feed. But we want to promote breastfeeding. And then from there, you want to teach children a healthy meals. So you need to prepare healthy meals at home with a healthy sandwich or healthy adding salad to the food that you make. And now we've seen that children are prepared just very common is just fried sausage and fried chip, and that's made for their lunch with no vegetables added to the container.
Ziad and I were having a conversation earlier on. We're talking about how some people don't realize when you are planning out your meals with meal prep, you may have, say, for example, a lot of carbs, and then they try to offset it with, say, for example, a lot of vegetables, but you're not burning off the calories, which is something you need to do.
Is that a good tactic to?
Yes, your diet must equivalent with your physical activity, and what you eat should be match up with your output, and that's something that most people lack. Physical activity is measured into different types. One is a very slow physical activity. What is recommended is moderate and vigorous. Moderate meaning that when you are doing a physical activity, you are unable to sing or unable to talk. That shows that the intensity of that physical activity is really intense, which is really good. But if you're making a walk or taking a 30 minutes walk and still you can sing, then that's not the recommended physical activity, intense physical activity.
Right. Well, welcoming Ms. Shika on the show as well. You are a type 1 diabetes patient, and I'd like to know your experience. How did you find out that you were diagnosed, that you had diabetes, and what's it been like?
I was diagnosed when I was 16 years old, back in high school, and it was a very terrible experience. I mean, as most of people, they don't know about type 1. Type 1 is the inability of the pancreas to produce insulin. So in that case, what we do is we inject ourselves every morning and every afternoon. And for that, we need to buy our syringes, we get our medication from the government. But for a teenager to go through their lifestyle, it wasn't easy. It still isn't easy, but we got used to it. I had an issue with myself when I was 16. I wasn't having my menstruation cycle normally, so I went through some doctors and they said it was normal, but my parents thought it wasn't normal, so we went through normal clinical procedure. We went to the Oxfam clinic and all those places. So in there they tried to take my sugar levels before the doctor saw me, and every time they measured my sugar, it was above 10. And slowly the nurses started to realize that that's not normal for a teenager. And so they started calling me on fasting, don't eat anything after 9 and come. And yet, my sugars were still above 20. So that was very high risk. And so they referred me, they diagnosed me with type 1 diabetes, and they referred me to the diabetes hub, telling me that they will take over from there, not solving the issue that I went there for, but diagnosing the other issue. So I was told by the nurses and the doctors there that what type 1 diabetes is, because in our mentality, what we had about diabetes, all we knew was it happens to you when you are 50 plus. Diabetes means amputated legs, eyesight, and kidney failure. So it was very emotional time for me. I cried, and then on top of them, they told me you have to inject yourself. Who likes injections? Nobody. But the fact that they told me that if I don't inject myself, it will mean that I can die earlier than my, if I take my injections regularly, I monitor my diet and everything, I can live a normal life. But if I don't take my injections, it will be very difficult for me. So yeah, I played around for a few days because I was scared of injections. But eventually, I started taking my dosage as prescribed by the doctors, and I realized that when I didn't take my insulin, I was mostly sleepy and tired. And as I started taking my medications, I started focusing on my studies, and it helped me a lot.
Sounds like a very harrowing experience, but congratulations to you for actually powering through and being where you are right now. Looking at work that you do with Diabetes Fiji, you mostly focus with youths. What's that like?
Yes, like as I was saying, when I was diagnosed, I did not know that there were some others just like me, because Fiji had no information about type 1, and that was something very new to me. And when I went to clinics, I used to sit with the old group of people who used to like tell me a lot about herbals and all those things, because they did not know about type 1 as well. So Diabetes Fiji had a camp back in 2014, I think. That's where we met the other young diabetics. They decided to call all the type 1s and have a camp educating them on type 1 diabetes and how to take care of yourself, your meds and everything. So there and then we formed a group. We named the group Young Diabetes Fiji, because we were looking at the age from 30 below. And in this group, what we did was that we realized the need for us to check our sugar levels, because as I told you before, in type 1 we have hypo and hyper. So there will be times when our sugars are getting really low, and and before we inject ourselves, we have to check our sugars. If it's really low, then we don't inject, or we take something sweet. And if it's really high, then we just have to be sure about it.
Right, well, I'd like to know more about the numbers and what the experience of other diabetics, young diabetics, has been like. But we'll be back with more after the break. Welcome back.
Shika, you did something lovely, which is mention the myths that exist around diabetes. As a young person having diabetes, you must have experienced a lot of criticism or myths around having diabetes. And you mentioned that some of your friends thought that it only happens to people above the age of 50, or diabetes is synonymous with getting your leg chopped off. As a volunteer, do you see a lot of that?
In type 1? Yeah, not in type 1 much, as I said, but just the fact that some of our young diabetics, they've been suffering because of the lack of medication. Like for us, we have to inject. If we don't have medicines, then complications happen, and most of us get really serious. So down in the West, there's a lot of shortage of medicine, and underprivileged youths whose parents are farmers and they can't afford to buy syringes, or they can't afford to buy the medication, so they suffer from that. But otherwise, I don't think I've seen any amputation because of type 1, but there may be some cases which I don't know of.
Well, in those instances, have you noticed that there may be some sort of bush doctor remedies being going around, herbal remedies and all that sort of stuff?
Yes, yeah, like as I said, down in the West and rural areas, even when I was diagnosed, people told me, you do this herbal thing and it will go away. But the fact, they need to know that type 1, it doesn't have any insulin. If I take a herbal medicine, it will lower my sugar, but the need for the insulin to, digest the other sugars, it's still there. And what happens is, if the sugar level is too high, it starts to affect our kidneys and eyesight and all those things.
So you inject insulin twice into your body each day, and you also have to constantly check your blood sugar.
Yes.
Approximately how much does that cost you?
Like as I mentioned, the medication is provided by the government, but the syringes, we have to purchase it. One packet has 10 syringes, which we can use for like 20 days maximum. And for checking our blood sugars, the machine is like, once we purchase the machine, we can keep the machine, but the strips, we have to regularly buy it.
The strips are not cheap.
It's not cheap at all. And
So would you say that for someone who's underprivileged, it would be difficult to access?
yes, very difficult.
On the note of those strips, I think Diabetes Fiji did do some work going out and meeting children and giving them strips and also machines to check their own blood sugars, correct?
Yes, we have a program which is program with the Young Diabetes of Fiji, which is trying to provide glucometer machines, glucose testing machines for underprivileged children. It is very important that every diabetic, not only type 1, but every diabetic must have a glucose machine so that he or she can test his or her sugar regularly. You know, the main thing is that you become empowered to take control of your own health and that you know when is your sugar usually go high, when does it go low.
How often should you check though?
Because of the cost, it's more reliable to check once or twice in a day, or usually after meal, 1 hour after or 2 hours after meal.
All right.
Usually the nurses or the doctors will advise you in accordance with the medication that you're taking.
Just very quickly, what are some of the future projects that Diabetes Fiji has?
We currently running projects for training of nurses and doctors. We thinking of going further and doing some programs in schools, more education on schools, and then secondly the education to communities, targeting very young ones. That's where we're thinking that if they get to be educated well, they probably will teach some parents. You know, we've seen that when they get to school, they get knowledge, and they usually tell parents that, you know, this is not good, why don't we have this? And that's why we are thinking where we will be moving towards.
Well, lastly, you've got World Diabetes Day happening on November 14th. What are your plans for that?
We have World Diabetes Day happening on November 15th. It will celebrate it in most health facilities, and that's where we do screening, and it's an opportunity for everyone to have their sugar tested, especially if you are a working person. You know, that's where we find them hardly come to get tested. And when we do screening, it's usually those that already know they have diabetes usually come back for testing. But we want those that are high risk. If you have parents who are diabetic, please do have your check done. And those are the time we do screening in areas, probably some in the communities, some in the town. And please do take advantage of the best screening that is done.
Well, thank you for that, and thank you both for coming on to the show.
Welcome.
That wraps up our show for tonight, and should you have any further queries on the matter, you can call Diabetes Fiji on 321-5370 or 321-5206, or you can email 8wkhan55@gmail.com. If you suspect that you may have diabetes, do be sure to visit your nearest medical facility for a checkup. And until next time, have a pleasant evening.